আসসালামু আলাইকুম। আমার নাম উম্মাইয়া। আমি বাংলাদেশ থেকে এসেছি। কৈশোরকাল থেকে পড়ার পর আমার কিছু শারীরিক পরিবর্তন শুরু হয়। আর এই সময় কিছু সমস্যাও দেখা দিচ্ছিল আমার। আমি এই সমস্যার সমাধান খোঁজার জন্যই চেন্নাই এসেছি। আর চেন্নাই আসার পর ডক্টর মীরা রাঘবানের সাথে আমার দেখা হয়। উনি আমার কিছু পরীক্ষা-নিরীক্ষা দেয় এবং উনি আমার সমস্যা খুঁজে পায়। আমার PCOS ধরা পড়েছে। তাই আমি জিজ্ঞেস করছি, আমার মতো যারা এই সমস্যায় ভুগছেন তাদের কাছে আমি একটু ডক্টর থেকে জিজ্ঞেস করবো যে PCOS জিনিসটা কি আমাদেরকে যদি একটু বুঝিয়ে দিতেন।
Sure. Hi. Lovely to meet you. Yeah, as she said, definitely PCOS is a very, very common problem, especially in the Asian subcontinent. And it is not a disease, but it is a metabolic disorder or a lifestyle disorder. Now, what is PCOS? It's something which is polycystic ovarian syndrome. Just having polycystic ovarian syndrome does not mean you have the disease. If you have irregular periods, if you have increased facial hair, if there is hair fall, and if there is any disturbance in the skin in the form of acne, these all put together mean that you might have the polycystic ovarian syndrome. This is because of hormonal imbalance in the body due to a slightly excess of male type hormones, which is the reason why somebody gets excess facial hair or acne and causes irregular cycles as well. People sometimes do not have periods for some 60 days or 90 days. Nobody should go without a period beyond 3 months, because that puts the woman under risk of developing increased thickness within the womb cavity, and that can cause heavy bleeding or something abnormal going on within the lining of the womb. And this, if it happens over years and years, can put the woman to risk of developing uterine cancer in the future. So the take-home message for any girl out there with polycystic ovaries and irregular periods: do not allow yourself not to have periods beyond a 3-month period. Beyond 3 months, you should take some tablets to get at least a withdrawal bleed. That's nothing wrong with it, but not having periods for prolonged periods like 6 months, 9 months is something very risky. So a girl or a woman should be getting at least 4 periods in a calendar year. That is the recommendation. So this is pretty much what generally happens as far as the symptoms of PCOS are concerned. So should you worry about PCOS at all? Probably yes, from a long-term point of view, rather than just period or babies or childbearing or family. Because PCOS, as I said, is not a disease, it's a lifestyle disorder. So your body is not metabolizing the sugars which you eat or the carbohydrates which you eat properly, and everything gets converted to fat. And the body pumps too much insulin, and the insulin is not well utilized by any other organ. The only tissue which will utilize the insulin very well in our body is the muscle. And the only way we can help the muscle utilize that insulin is by physical activity and exercise. So which is why exercise and regular physical activity of moderate intensity, at least 5 days a week, lifelong, is recommended as the first step towards the correction of PCOS. The second point is eating a diet which is good in nutrition but low in energy, which means low carb, low fat, high protein diet with more fiber in the form of vegetables and fruits. Adequate hydration, avoiding very sugary or processed foods like in tinned food or canned food, because these have at least 4 to 5 times more salt and sugar than what is found in our fresh food items. Especially the sauces which is available in the tins and cans. If you see at the nutritional value of the sugar content is very much in excess, and these don't get processed in your body, and everything will be converted to fat. So physical activity, proper diet, and most importantly, good adequate sleep for 7 hours every day is a must for everybody with polycystic ovaries, because lack of sleep also alters the hormonal balance and predisposes somebody to have irregular cycles. The usual cornerstone which we use for these women is to try and encourage them to lose weight if they are overweight. Even a loss of 3 to 4 kilos does wonders to the hormonal imbalance which can happen in polycystic ovaries. and they're also encouraged to go on certain medications which control the hormonal imbalance and thereby prevent the acne. In the long term, they should watch out for not becoming overweight in the future. Make sure they're having periods every 3 months. They should look at their cholesterol levels on a regular basis. And if they fall pregnant, they should make sure they are not becoming diabetic during pregnancy. So, as such, in a nutshell, PCOS is a lifestyle disorder. It can be easily prevented or put under check. The most important thing is its long-term implications for future metabolic health, because PCOS, if left unattended, can be a risk factor for developing diabetes, blood pressure, cardiovascular problems, and even cancer of the womb and the ovaries in the future. So it's very, very important that we understand the underlying metabolic disturbance which happens in PCOS and not just superficially treat it. So exercise and weight limitation still remains the first and foremost step towards correction of this long-term problem. Hope this will be useful for some information and for your treatment as well.
Thank you, ma'am.
Most welcome.
Thank you.